So I'm going to start the presentation now. All right. So how to solve arthritic hip pain without surgery. That's my name, Dr. Joseph Tanti. So we're going to go through this here. And basically, these are the key things we want to cover today. So why should you listen to me? Who am I? A lot of people on the call already know who I am, but some people may not. What is hip arthritis? What isn't it? Why does it matter? How do we solve it? Of course, go through a case study and then have lots of time for questions and answers at the end. So I'm going to be going at a fairly decent pace here. Some people say I talk fast. My wife does. So remember, I'm recording this. I'm going to be sending this out afterwards. The presentation, as well as the recording, assuming everything gets recorded well, excuse me, you will get that tomorrow or the next day. So don't feel like you need to write anything down, okay? So me, Dr. Joe Tanti, I'm a fellow of the Chiropractic College of Orthopaedic Specialist, diplomate of the International Academy of Neuromusculoskeletal Medicine. Essentially, I think there's about like 5 of us in Alberta. There's about 2 of us in Edmonton, 1 of us in Sherwood Park. There's not many of us around, not many orthopedic specialists around. Essentially, if you have some type of bodily pain or injury, we're able to diagnose and treat those problems. So not just spinal related. I tell people I treat everything from your toes to your nose and everything in between, as long as it's not an organ problem. If you're having a heart attack, obviously don't come to see me, go to the hospital. But if you're having any other problems, we're able to help with that. Also wrote the book, My Hip Hurts. Imagine that, on this very topic. So also for everyone on here, if they want a copy, just let me know, and I can send you a copy. They're about $20 on Amazon, and hopefully you find it helpful. It's going to be on some different information than this presentation, so you may find that useful. I just got them in the other day. So that's who I am. Why do I do what I do? Well, these are my little boys at home. This is Archer. He's the toddler, or the little guy there. He's 11 months now, turns a year next month. And that's Everett. They're just in the grocery cart. And that's why I do what I do, because I love them and love to see them grow and all of that. So onto the topic, hip arthritis. A lot of times people think hip arthritis is a wear and tear type of condition. But the reality is it's not. They say that it has to do with, oh, I'm just getting old. And if that were the case, then why does sometimes one side of your body get arthritic and the other side not? Why do one area get arthritis and another area does not? I'm assuming that your whole body is the same age. We're not old. One area is not older than another. So it's not so much a wear and tear type of problem. It's more of a wear and disrepair. Essentially, stresses, strains go through our joints, through our body, and our body is able to heal itself. All these little micro traumas occur throughout a lifetime of life, and then we're able to repair ourselves. And that's why we're a self-regenerating machine, essentially. But sometimes there's going to be these functional deficits. There's going to be these extra stress, extra strain on certain areas of our body, and then our body is not able to keep up with the repair. It's not able to maintain that normal tissue. So then that's why certain areas become more arthritic than others. Also, if there's certain types of traumas, for example, people in motor vehicle collisions, they're possibly more likely to develop arthritis earlier than if they weren't in a collision. People that have fallen on their hip, for example, or fallen from a tall height, and they've had some type of trauma to, say, their right leg or their right hip, they're more likely to have arthritic changes in that right side compared to the left. Because of that trauma, your body's not able to keep up with the repair as rapidly. Other reasons is that oftentimes we'll have certain postural habits. So for example, if you're standing, you might stand over on one side a lot more. You might kind of lean off to one side when you're sitting down, might cross one leg a lot more. And it's not that big of a deal in that moment, but life over time seems to catch up with us. And those extra stresses and strains just puts a little bit extra stress through those joints, through those places, and our body can't keep up with that repair. So then that arthritis starts to kick in. And the older we get, the slower we repair. You may just think of yourself, for example, when you were, in your teens and 20s, if you got a paper cut, you'd probably pretty much be healed within, a day or two, and you're totally fine. I'm in my 30s, and I noticed that they take a little longer. Sometimes they last a couple of days. I have patients where they get a cut, and sometimes it takes months for that skin to heal. So that's just the skin, but that's also happening everywhere in your body. So we just heal slower. So that's often why that arthritis can be more present the older we get. Oh, why aren't you changing? There we go. Okay, so that's what hip arthritis is. It's not a wear and tear, it's more of a disrepair problem. This is an example of an arthritic, this is an example of a hip replacement. Okay, so we can see this is an x-ray on the left side of your screen. You can see that little, I don't know if you can see my mouse here, but this is the metal rod essentially that they've replaced the hip with. So essentially what they're doing is they're cutting off the head of your femur, the head of your leg bone. They're cutting that out and they're replacing that with whatever type of material it is here, metal or ceramic or whatever it is. And they put that in there, and then they have this huge rod and they shove it down your thigh bone. And then that's going to take several weeks for that to heal and kind of cement and become one structure. And that's why there's no longer going to be arthritic hip pain, because there is no longer any bone joint there. So this left side of the screen, that's the right hip, is replaced. You can see on the left side, their left hip or the right side of your screen, there's a little bit less joint space here, a little bit of sclerosis here, but it's not too bad. I'm going to go to the next. Okay, so here on the right side of the screen, we can see a pretty arthritic hip. You can see that this, if you follow my cursor here, there's like there's not very much joint space here. On the left side, you can see the bones are nice and smooth here, this hip joint, right? The bones, it's nice and smooth. There's good joint space there on the top there and on the inside. But on the right, there's a lot of whiteness. That's called sclerosis. You can see a lot of osteophytes, basically bony growth in through that on the right side of the screen. And there's very minimal joint space at all. So those are what I'm trying to do with these lines, just to show that joint space. So that's a pretty severely arthritic hip compared to the other side. Again, both hips are the same age, but why is it one side versus the other? That is the question. And this is a normal hip. So you can see good joint space on the top and on the inside here of that joint. And the bone is nice and smooth. That's a good joint. So that one's not arthritic at all. So that's kind of what arthritis is. Oh. Now I'm going to show you what a typical arthritic, someone with hip arthritis, what their gait looks like. Now I couldn't find a perfect video of this online, but this is a pretty good example. It's not just with hip arthritis, but a lot of problems, especially hip arthritis. So here's just from the side. Oh, it doesn't want to play. Oh, here we go. So call this a Trendelenburg walk, or this is a compensated Trendelenburg gait. Now, oftentimes in a really arthritic hip, they're not able to get their knee past their hip here. It doesn't go past. So they're going to kind of waddle like this. They're going to kind of favor that hip, lean over top of that hip. So it's going to look something like this, but a little bit different. And this is from the front. Oh, let me just go past here. This is the same thing, but from the front. So you can see how he's kind of waddling. He's kind of favoring that side. This is an extremely common gait pattern. Now, oftentimes in the office here, I get people to walk just to see how they walk, and they have no idea that they walk like this. They actually have no idea until someone points it out or they see a video of themselves. They actually think they're walking straight. So there's not always pain associated with this. It's just, but it does change your gait. So now when you're out in the malls and you're people watching, feel free to try to point out this or see if you can see this. And I guarantee you're going to see a couple of people if you're in a busy area. There's a lot of people that have this type of gait. It's not always from hip arthritis, but that is one of the causes. So why does hip arthritis even matter? And there's a couple different reasons. One, it reduces your mobility. So why do we need mobility? Well, it's to do things, to use your body, getting dressed, walking, running, exercising, doing everything that it is you need to do or want to do. You have to be able to move your body. And when you can't move your body, you can't do the things you want. And that's just not good. It also can be very painful. And pain, as you know, can be draining. A lot of people say they have a high pain tolerance, and a lot of people do. But acute pain is different than persistent pain. And a lot of times, hip arthritic pain, it's constant. And constant pain really drains on you. It drains your life. It drains your energy affects your mood, which affects your relationships, can affect your identity. Let's pretend you're a runner and now you can't run. Well, now you're no longer a runner. So sometimes people get kind of an identity crisis. They can't exercise anymore. They start putting on weight. They start developing other chronic problems, other health conditions. They start taking lots of medications, polypharmacy, maybe mood problems now because they can't do the things that they want to do. So it's just really, it can be a really slippery slope and a downhill slide for these kind of people. And pain just really sucks. At the end of the day, hip arthritis really impacts your quality of life and really just to be able to do what it is you want to be able to do. And that's really why it's so important that we resolve these issues as quickly and effectively as possible. Now, the timeline for people having hip arthritis essentially starts from left to right here. So first, you're just going to get a little bit of stiffness in your hip, maybe not all the time, maybe just when you wake up or after sitting for long periods of time. Then you're going to be getting some intermittent discomfort, maybe even some pain. This is typically going to be in the front of your hip, sometimes like deep in the glutes, deep in the butt, and sometimes on the side of your hip. Again, as that gets worse, it's going to become more constant, maybe painful, maybe just stiff. Oftentimes, this is where people are going to come in to see me where they're having some discomfort and they're like, oh, something might be going on there. Oftentimes, they're going to be limping, and this is where they don't really know that they're limping, having that Trendelenburg gait that we just saw earlier. Again, as things get worse, it goes all the way into where you can't really walk too much at all, if you can, and there's going to be constant pain. So this is kind of the progression, and this can happen over weeks. This can happen over years. And it really is dependent on the person. Everyone's a little different, but that's kind of the progression that we see. So now we're going on to how do we actually solve this problem all without surgery? Obviously, without surgery is the only thing that we can actually change the structure, but there's still a lot of things we can do to help maintain the mobility of the hip, maintain your strength, maintain your functionality, and have zero pain, ideally, without surgery. So we're going to have to go over accurate diagnosis, self-care strategies, and conservative care strategies as well. And we all know that the goal with this is to have no or limited pain, optimize your function of the hip, and improve your quality of life. So it doesn't really affect you and you can do everything that you want and need to be able to do. Now, if you don't have an accurate diagnosis, we don't know what we're going to do, right? If you don't know what the problem is, how can you treat it? It's kind of like, I like to use an analogy of spinning on the teacups at Disneyland with a blindfolded and trying to hit a dartboard if you don't have an accurate diagnosis. So we need to know what it is in order to treat it. And one of the gold standards with that is X-ray, but also doing a thorough examination as well. We're going to go over some self-care strategies. So you need to be doing some stretches, okay? We need to be stretching all the muscles essentially that cross the hip. When that hip is arthritic, it's going to be a little inflamed. So all those muscles that cross that hip are going to be affected. Your hamstrings, like the back of your thigh, the inside of your thigh, which is the groin and adductors, the front of your thigh, which is the quads and hip flexors, and also the back, so the glutes, your butt muscles essentially. But it's also going to change how you're walking. So your calves, the lower leg essentially is going to get really stiff and tight as well. So you need to be stretching those areas. Now, I'm not going to go over individual stretches here because it's not really a great medium for that. And there's millions of stretches that you can do, okay? So what you can do to get a couple stretches if you don't know how to stretch these areas is simply go to YouTube, youtube.com, and then you just type in whatever body part it is, legs, or you can put hamstrings or groin or quads or hip flexors, and then put stretch. And there's going to be a million videos on there, and take a look at a couple of them. See which ones you think you're able to do and give them a try, okay? There's no wrong stretch. But the idea is that when you're doing these stretches, it should feel like a gentle pulling or like a tight sensation in the area that you're actually trying to stretch. If you're trying to stretch your hamstrings and it's causing a lot of groin pain, that's probably not a great stretch for you. So I would just search those and see what you can find. There's a ton of videos. So I didn't want to bog down today's, we only have limited time here. So I didn't want to bog down with all those different types of stretches you can do. Just go to YouTube, type in the body part and type stretch. And there's going to be a million of them there. Okay. Should feel good. Okay. We also can do some mobilization type of exercises. This is trying to get the mobility back into the hip so it's actually able to move. Now, as that arthritic process happens, what happens to the joint is the synovial fluid, which is in a normal joint. It's usually kind of like that oil in a car. It helps lubricate the joints, keeps it smooth and moving. As it become more arthritic, that fluid starts to kind of get a little more stiff. It turns more into like molasses. So it's the stiffening of that joint. So that's why initially when you get up in the morning, it's really stiff, sore. And then the more you move around, the looser it gets. It starts to feel pretty good again. So the more movement we can do, we start to kind of move around that molasses material, starts to loosen up, starts to feel better, and the muscles can start to relax. So there's different types of mobilizations you can do. You can do mobility exercises without any external help, and you can do them with some external help. I like to use bands. Now, these are just a couple video examples of some mobility exercise you can do. Again, just go to YouTube, type in hip mobility exercises, and then these are going to pop up. I'm not going to, again, I'm going to send you this recording afterwards and the videos afterwards, so you can check these out later. But I'm not going to go through each of them. They're a couple of minutes long and we don't have time to do that. So I find it interesting too. A lot of these videos, they're typically younger people without arthritis that are showing them, but some of them, they clearly have some arthritic issues. So I would look more for those ones. You don't want to be doing the mobility ones where there's like someone in their like early 20s, they have a ton of mobility. So do ones where people actually look more like yourself, for example. So these are just some mobility exercises without help externally. And then there's also ones you can do with a band. Essentially what you're doing with this is you get like a strong exercise band. Excuse me. So not one of those TheraBands that are really thin. You got to get a strong exercise band. They typically have about 50 to 80 pounds of pressure. It depends on your weight and your strength, but it has to have like some good resistance, but you know, it should be able to actually stretch it as well. What you do is you strap it around your hip here. Again, just go to YouTube and type these in, and I'm going to send you this afterwards. You can watch these. And then it's basically doing some traction on the hip to try to get a little bit more mobility in them. And these can be extremely helpful. This bottom one on the bottom left here, some gentle traction. I do this all the time with everyone who has an arthritic hip. I always suggest they do this. It can be really, really helpful. It's not going to fix it, but it does help. Okay, and there's a lot of different strategies and ways you can do this as well. So I'm just going to skip through all of these. All right. So we talked about some stretches. We talked about some mobility strategies as well, with bands or without bands. What about some pain control? So a lot of times arthritic hip pain can be extremely painful. It's hard to do some of those stretches. It's hard to do some exercises because the pain is too much. So we need some strategies to manage the pain, to get things under control so you can actually do the stretches, exercises, and that's what's going to help long term. So there's a lot of things we can do. You can do heat or ice. The good news is it's really low risk. Sometimes it can get a little messy if you use a lot of ice with the melting, but there's really low risk with that. You can use a TENS machine, or a lot of people call it like the Dr. Ho machine. It stands for transcutaneous electrical neuromuscular stimulation. It's a lot of words. Basically, it's a machine that uses electricity and pads, and the idea is that it kind of blocks the pain signals from reaching your brain, so they can't cause pain. Any type of topical cream, Biofreeze, Voltaren, A535, Deep Blue. There's a million different types of topical creams. They all work to some degree. Some work better than others for different people. So try a bunch and see what works best for you. You can do a bunch of different tissue therapies, such as self-massage, foam rolling, Epsom salt bath. All those types of things are really helpful. And all of these things, what they're trying to do is they're trying to block or reduce the pain signals from the hip, from the muscles in that area, from reaching your brain. That's all they do. Okay, so they don't fix things, but they can help reduce the pain. Obviously, the pros with all these self-care strategies is they're relatively low cost. Heat and ice, not very expensive. A TENS machine that can cost a couple $100, but you can use it anytime, wherever you are, anytime you want. The creams, they're pretty cheap. And doing the bath and the self-massage, those are pretty cheap. So really accessible. There's really low risks. You can cause burns with the TENS if you're using it incorrectly, and you can burn yourself with heat and ice, obviously, but that's pretty low risk if you're being responsible with that. Cons, obviously, can get a little bit messy sometimes. It's not technical. Some of them, it's relatively low cost, but it's not free. And also, if you're not getting results with these and you're just relying on these strategies, free isn't just money, right? It also has to do with time. If you're not getting the results you need, is it really free? Because it's going to take you longer, taking you longer to get better. It's impacting your quality of life. You can't do things that you want to do. So it's not free in terms of time necessarily. And remember, these things aren't a fix. They're not fixing the problem, and but they can help. And obviously results can vary. Some people find like topical creams extremely relieving, and other people find they don't help at all. Some people find TENS machines extremely helpful, and other people not so much. So results can vary. Now, the question I want to ask you is, do you feel like you're fit enough not to exercise? Feel free to type in if you feel like you're fit enough not to exercise. Any takers?
No.
No. Okay. Someone says no. Good. You're right. You're not fit enough not to exercise. You're not. We all need to exercise at least to some degree. Now, there are some guidelines for this. Physical activity, some American guidelines, some Canadian guidelines. They all say this pretty much the same thing. You need to be getting, at bare minimum, this is the low bar, you need to be getting at least 150 minutes a week of moderate to intense activity a week. This includes any type of exercise, really, brisk walk, getting that heart rate up, okay? Bare minimum. So that's about 5 times a week, about 30 minutes. So if you go for a walk, 30 minutes a day, if you're doing some weights, and you also want to be hitting the resistance training to hit all the major muscle groups at least twice a week, especially working on strengthening the muscles and improving your balance. The older we get, I see it all the time, people's balance typically starts to decline for multiple reasons. We're not going to go on that today. That can be another whole topic. But so really working on that can be extremely important. And also, the older you get, the more you don't use it, the faster you lose it. So you really got to try to maintain your muscle mass by exercising your muscles and using them, or else things can go south really fast. So those are the minimum guidelines. Okay, so just keep that in mind. If you're hitting those, congratulations. You can always do more, but try to get at least 30 minutes a day, 5 days a week of some type of moderate exercise. Now, there are, of course, some specific exercises for someone who has arthritis in their hip. We want to be, again, all the muscles that cross that hip, we want to be stretching them, we want to be mobilizing them, but we also want to be strengthening them, okay? So your gluteal muscles, your glutes, your hips, your quads, that's the front of your thigh, the inside of your thigh, your low back, your core, the lower leg. You want to be strengthening these areas, incorporating those into your training routine. Again, you can just go to YouTube and type in, glute exercise, hamstring exercise, balance exercise. There's a ton of them out there. Okay, try a couple and see how they work for you. Bonus, if you're doing the balance training, if you're improving your mobility in your feet and your ankles, a lot of times people lose mobility in their feet and their toes especially, and that can impair your balance. Again, that's a topic for another day. And also improving your aerobic capacity, your aerobic endurance. The better your aerobic system is, the healthier you are, essentially. There's an old joke or proverb, I think it's a Russian thing, where they had 99-year-old grandmother. She was at her 99th birthday, and the whole family was gathering around. She was really rich and so forth. And then she had 99 candles, and she blew them all out in one breath. And everyone knew that she was going to stay there at least a couple more years because she had great endurance and so forth. And so that's extremely important to be able to do that. Okay, so you want to improve your aerobic endurance quite a bit. Okay, we're going to talk about strengthening exercises. The benefits is we're going to reduce these functional deficits that are often kind of a predisposition to causing hip arthritis. Remember I said that at the beginning that arthritic hips, they typically are at least more dominant on one side. So it doesn't necessarily have to do with your age, but assuming that it wasn't due to trauma, there's going to be some functional deficit there. Oftentimes it has to do to weakness within the glutes and within the core and your leg, especially on that more sore side or that arthritic hip side. So improving the strength in that side, especially both sides, but especially that side, is going to help reduce the stress and strain on your hip and knee joints. I've also seen time and time again where someone may be extremely arthritic, but they have minimal pain or discomfort. And the difference between someone with minimal pain and discomfort who's really arthritic and someone who has a lot of pain and almost debilitated is a lot of time how strong they are. The people who do really well are typically really strong. They have a lot of muscle. They're very strong. And the people that don't, they have a lot of muscle wasting. They're quite weak. They don't have any tissue really there at all. So it's really important that you're able to maintain your tissue integrity and strength as long as possible. That's going to help tremendously to reduce the stress on your joints. Sometimes the problem with exercising is that it hurts. Sometimes you don't know what exercises to do specifically. Like I said, there's a million different types of exercises. And sometimes people think if it hurts, it's making it worse. That's not necessarily always the case. So that's why it can be sometimes difficult. And this is why oftentimes people go to people for help for these problems. So the question is, who should you see? There's a lot of options out there, and that's why it's so confusing. Physio, acupuncture, medical doctor, massage, chiro, yoga, Pilates, exercise at the gym. Sometimes prayer helps. So what should you do? This is the question. Now, I want to try to change your mind on thinking not what or who should I see, but what do I need? Okay. We need to focus on a couple things. We need to focus on the joint mechanics, how the actual joints are moving in the hip, but also peripherally, the knee, the ankle, and your back. Due to the functional changes in the joint mechanics. Are you going to be doing you need to be doing some stretches, some mobility exercises and programs. You need to be doing a strengthening program. You need to address any compensatory or faulty movement mechanics that are either because of how you walk now, because of your hip pain, or that were actually leading towards your hip pain. So you need to address these. You need to address the nutritional component to arthritis. There's a huge nutritional component that I don't want to have or don't really have time to get into today. And also the inflammatory components to pain. A lot of times pain is due to inflammation, so able to reduce that inflammation. So it's not so much who should I see, but who's able, or maybe a combination of people that are able to address all of these different things. If you just address one of them, for example, you take some NSAIDs, some anti-inflammatory medication, that might reduce the inflammation or a mild to moderate amount, at least during that period of time. But if you're not addressing the joint mechanics, then the pain's going to come back. If you're not addressing how you move, the compensatory movements and those functional deficits we talked about earlier, the pain's just going to come back. If you're not stretching, if you're not strengthening, if you're not addressing your nutrition, the pain's going to keep coming back. So you really need to be addressing all of these things to get lasting results. If you just do one or two, it may help temporarily, but it's probably not going to be beneficial for you long term. So who's able to do that? I wonder. Obviously, I think I can. Orthopedic specialist. There's multiple providers that can do all of these things, or at least components of these things, but they really need to be all addressed. And this is why sometimes taking a multidisciplinary approach can be quite helpful, because we all do things in a slightly different way. I just have a video coming up. This is someone who was dealing with some hip arthritis, and she just kind of tells her story here. So just bear with me here. I'm just going to speed it up.
Dr. Joe, I can't hear any sound.
Okay, no one can hear the sound.
Weight on it.
Can you guys hear it now?
It usually took 2 or 3. I was limping enough for friends and neighbors to start noticing that something was wrong. Okay, so my right leg was really giving me issues when I was standing up from sitting down. It was really stiff, and I was limping enough for friends and neighbors to start noticing that something was wrong.
Sorry, I'm going to stop touching it. So stop restarting.
My right leg was really giving me issues when I was standing up from sitting down. It was really stiff and it hurt. Sometimes it was a shooting pain through my leg when I put weight on it, and it usually took 2 or 3 steps, if not longer, before I was actually walking upright. So that wasn't great. I also had issues, even when I was just sitting down, it would be constantly aching. So sometimes it was more achy than other times, but it seemed like it was aching most of the time. And sleeping was also difficult because my leg was constantly aching, and turning over in bed was also very sore and painful. I couldn't lay on either side without my leg complaining. And walking, I was limping quite a bit. And especially, well, I was limping enough for friends and neighbors to start noticing that something was wrong. So
Were they making comments and stuff like that?
yes, they were. One of them actually recommended I come and see you.
What would you say are some of the activity limitations that you have?
Even just walking the dog wasn't as enjoyable because I was concentrating more on how I was walking and how my leg was feeling than what the dog was doing. So our walks were shorter because I couldn't go the distance, which wasn't good. And also it was in the wintertime, I was really afraid of falling, because if I fell, I was concerned that I'd hurt myself some more or I wouldn't be able to get up. And that's the first time I've ever been leery about walking in the wintertime. I also enjoy jogging, but that just wasn't an option with my leg aching and being so painful.
How'd that kind of make you feel?
Frustrated, really down, helpless in a way, because I was doing things to stay healthy and to stay mobile, and yet this ache in the leg, this pain in the leg just wasn't improving, certainly not fast enough.
How long were you dealing with it for?
Since I would say last September, and it probably stayed fairly consistent in where it was at until about January, where I had a few falls on the ice and the snow, and then it seemed to get worse. And that was, again, more painful, more constant pain.
So then your neighbor suggested you come in here and you're kind of hesitant. Walk us through that kind of process for you and kind of what you experienced and what you were thinking as things were happening.
Well, I came in to see you, and I thought, well, it's worth a shot. I tried chiropractic for my arm many years before, and it had worked well. So it seemed like the exercises that I was doing by myself were not getting my leg better. So I thought, let's give this a try. And then I guess to start off with, it was a couple of times a week. And I won't say that things got better immediately, but there was definitely the improvement that kept me coming back. And now it's a few months later, 3 months later, 4 months later. And I'm really happy with where I'm at.
That's great to hear. I'm glad you're feeling so much better. So how is life kind of looking like now? Like, what are the things you're able to do? You're having difficulty walking your dog, feeling confident going out, exercising.
So walking the dog, it's all good. We can go the longer distances because I know my leg is going to hang in there. Jogging, I haven't tried yet, and I think I'm going to give that a little while. As far as sleeping goes, my leg isn't keeping me awake all night type thing. I don't have aching and pain in my leg when I'm just at rest. There's maybe a little bit of an ache if I've been sitting for a while for the first step or so, but it's so much different than what it was before. It's, I would say, almost back to where it used to be before the problem started.
That's great. That's great to hear. What would you say to anyone who may be dealing with this kind of thing or similar issue and maybe a little hesitant to try out chiropractic, come in or try different things that can get it feeling better? What would you kind of say to that person?
I would say to give it a try, because it's the adjustments that you did were not painful. A lot of it is stretching, or I don't know how to describe it, but it's not painful. And it feels good afterwards. And to be able to move around without the pain, without using painkillers, and to feel that it's all been done in a very natural way is the best as far as I'm concerned. Like there's no invasive surgery, no pills that you're constantly taking. And from my perspective, no worries that my leg isn't going to support me when I need it.
I know you're really big on the natural route and really don't like taking medications. I think you were taking some medications before, right? And they were kind of moderately or mildly helpful, if anything at all. Yeah.
Basically, I'd be taking a usual painkiller now and then, but it didn't really help.
Okay. Anything else you want to add? Anything you feel like I kind of omitted or didn't ask you about?
I guess as well, one of the things that I liked was that the appointments very quickly went from 2 a week to 1 appointment every 2 weeks to once a month. And now we're up to 1 appointment every 2 months type thing. So just knowing that this isn't something that I have to work my schedule around every single week is awesome. And, to know that, okay, so arthritis can't be fixed and made to go away, but it can definitely be worked with, and general regular maintenance helps keep me moving.
Yeah, so true. I just want to ask you actually one more thing, if you don't mind. What would you say some of the treatments that you're having done, how would you describe those? Like a lot of times people will think the chiropractor will just kind of, you're in there for 30 seconds, they'll kind of snap your back and then send you on your way. And then you got to go in, like you said, like once or twice a week, but indefinitely. And sometimes people are concerned about that. So sometimes people will not come in because they may feel like, well, if I go once, I got to always go then. So I just don't want to get started. What would you kind of say to that?
Obviously it's not true, but I mean, to start the session, it was always a case of you asking me, how are you doing? How are you feeling? Having a look at how I'm walking. And then it wasn't the same adjustments every single time. Like you would, I think it was adjusting my hips or that lower back most of the time. And also, doing some traction and some stretching exercises, as well as some range of motion type stuff with the hip. So it's not just a case of me going in there and you saying, okay, we're gonna snap my back type thing and going off. It's more personalized to what I'm dealing with rather than one size fits all.
Well, I really appreciate your time, Amanda.
All right, so that was just Amanda. She had a if you're listening to that, you probably could identify with a lot of the things that she was dealing with. She kind of went through the classic type of presentation with someone with hip arthritis, that progression with the stiffness, and then eventually it starts really catching up with you, affecting how you're walking and all those types of things. And we're doing a lot of different types of therapies, not just one, but trying to address all those factors that need to be addressed for someone with hip arthritis. And she's doing very well now. So we couldn't touch on everything related to arthritis today, because again, that would take way too long. And I know you don't want to spend all day here. So things we missed on are a lot of the nutritional components. So you are what you eat. You may have heard that before. The different types of sequencing, rep schemes, the exact stretches that you could or should be doing, because that's really individualized for each person. The different stretching, strengthening exercises, different weight loss strategies. A lot of times, like if you're 600 pounds, that's a lot of extra stress on your joints. So losing weights can sometimes, for some people, be very helpful for those that are suffering from joint pains, especially hip arthritis. There's a lot of useful supplements out there as well. They're not called cures, they're called supplements. They supplement your diet and what you're doing and how you're living. So you need to be mindful of that. And also, we talked a little bit about pain, but didn't really go into detail about how it exactly works. And that's a whole, again, other conversation that I'd be happy to talk about, but that'll take a little while and we don't have time today. Here's some useful resources. So OA Action Alliance, they're great. A lot of information on arthritis, arthritis.ca. That's a Canadian site about arthritis. Deflame, that's about nutrition. The guidelines, that's about a movement guidelines. Here is some exercises from Canadian Chiropractic Guideline Initiative. So this is all research, evidence-based exercise you can do for back pain, hip pain, all those different things. And then a couple exercises you can look up on YouTube just at the bottom there. There's obviously way more resources than this out there, but these are some really good ones that you can check out. Again, you're going to get the recording of this afterwards and the presentation notes as well. Hopefully the recording is actually working. So at the end of the day, once you have a confirmed diagnosis of hip arthritis, there's a couple different strategies that you can use, okay? One is obviously using all the strategies that we talked about today, all those self-care strategies, the stretching, the mobilizations with and without external help with the band, the strengthening exercises. All those are crucially important, okay? So definitely start there. Make sure that you're meeting those minimum exercise guidelines, 150 minutes a week or 30 minutes a day, 5 days a week. Obviously, there's one-on-one treatment. This allows you to get out of pain faster. Oftentimes, you get specific personalized treatment plan for you. We're going to address any the hip, obviously, but any of those functional changes that have occurred, get better faster, get out of pain faster. You kind of know how far along you are in that arthritic process. A lot of people don't know. They're very mild, or if anything at all, but they might be told that, oh, you have arthritis, and they think it's the end of the world and they need surgery. And a lot of times that's not true. So getting rid of the guesswork. So one-on-one care is obviously an option for you. The third one, I'm thinking of implementing this, is basically a group class doing where it'd be an information session / there's going to be an exercise component. So kind of getting that personalized approach. You get one-on-one time with me. There's going to be some positive peer pressure as well with exercising. A lot of times, if you see someone next to you who's in obviously a lot worse shape than you are, and they're doing more than you and pushing through, that's a little bit of positive peer pressure to get you kind of motivated a little bit. Having the confidence to know that you're doing things the right way, because it's going to be kind of guided, and asking any specific questions tailored to you and getting kind of the answers from someone who knows their stuff. So I'm thinking of doing these exercise classes essentially in addition to the one-on-one care, just based on people's interest basically in this. If there's interest in it, I'm thinking of starting running those in the next couple months. One of the benefits of this is that if you're actually a patient, portion or all of it, I'm not sure in the logistics yet. Again, I'm just gauging interest, but may actually be covered through your extended healthcare plans. Through your insurance, we're actually able to bill through that. So that's an option for people moving forward. If it's something that you're interested in, please let me know, and we may start running that up in the next couple of months here. So that's all I got for you today. I'm going to stop the share here. Okay, does anyone have any questions about anything that we talked about or anything else? Any questions for me? Karen, you'd be interested? I'll write that down. Feel free to type in the chat or just unmute yourself and ask away.
Hi, Dr. Joe. It's Lisa here.
Hi, Lisa, how are you?
Good. Question about pain at night.
Yes.
When you do get pain at night, is it indicative of the fact that either you're relaxed and then you tense up, or is it indicative of more so what's happening during the day kind of catching up to you at night?
Right.
What would you say?
So that's a bit of a complicated question. So the answer I'm going to be a little vague. Couple different possibilities here. Do you mind if I ask you a few questions?
Not at all.
Okay. So is it also sore in the morning?
Yes.
Okay. And is it keeping you up at night?
No, it's just waking me up at night.
It's
And then
so you go to bed, it
then
feels fine, but then it wakes you up.
Yes.
Okay. And so typically speaking, especially with an arthritic joint, hip, for example, but other areas as well, shoulder, it could be a couple possibilities. If it's the hip arthritis, typically what's going on is when you're not moving, remember we talked about the joint, the synovial fluid, it starts to turn into like a molasses type material. So when you warm it up, when you're moving around, it starts to loosen up, become more fluid. Once you stop moving, that starts to stiffen up again. Okay. And oftentimes it depends on how inflamed you are. And if your joints are really inflamed, like to a moderate amount, when you're moving around, they feel better because movement, there's a lot of motion, it's flushing that arthritis or that inflammation away. But once you stop moving, that inflammation starts to kind of build up again. So if it's waking you up at night, what's possible that might be happening is that inflammation just is building up when you're not moving, and then it wakes you up. Another possibility is that a lot of people with hip pain, they have specifically pain on the side of their hip. So not kind of in the groin or kind of in the butt, but more on the side. Sometimes that's from arthritis, but sometimes it's also because they have a tendon problem. They have a tendinopathy. A lot of people call it bursitis, but most people are wrong. It's typically a tendinopathy. So a muscle problem. And if you're laying on that hip, that gradual compression over time makes it more and more grumpy and more sore. So then is it the side that you lay on, or is it the side of the top side?
Side that I lay on.
Okay. So it's also possible. And is it on the side of your hip?
Yes.
Okay. So it's more likely you're having this tendinopathy issue. So gradual compression over time can make it really sore. So it might not be arthritis. It might actually be just that compression. So if it's, for example, the top hip, so the hip that you're not laying on, but you're on your side, putting a pillow between the knees can help, just because of that when the knee falls towards the middle of your body, it causes compressive forces on the hip and it makes it grumpy. And then again, it can get really sore and then wake you up. If it's the hip you're laying on, it's because you're putting a lot of pressure on it, just your body weight, right? over time that makes it more and more sore, and then it gets to a point where it actually starts to wake you up. That's a possibility as well, and probably more likely.
Thank you.
Yeah, so try not to lay on that side, essentially. Sometimes laying on your back can be helpful. Exercising, you got to stretch it, you got to exercise those muscles and get them stronger, and obviously we can help with that here as well. I hope that answers your question.
Yes, it does.
Awesome. Does anyone else have any other questions? Gary's interested. Very good. Karen, you need some peer pressure. Don't we all sometimes? Sometimes working out at home is really difficult because there's no one around and you have stuff to do. Sometimes going to those group classes can be really helpful for that peer pressure and just kind of people guiding you along. And if you have any questions, feel free to type them in or unmute yourself, and I'd be happy to answer any. We have about 14 minutes.
Dr. Joe, this is Rita.
Hi, Rita.
I don't know if you can answer this or if it's too complicated, but I'm just thinking because I have friends with hip problems or friends with knee problems,
Right.
but then they get the other thing because of they're waiting for surgeries and so on. So if you have, for example, a hip problem, hip arthritis,
Yes.
is there anything you can do to be proactive to not start damaging your knees as well? Or is there like as on top of what you've already given us here?
Right. So again, there's a lot of strategies to offset trying to stop the arthritic process from developing or getting further along. And the answer is yes, there's tons of things you can do. The problem with waiting for surgery is there's a couple things. One is it takes forever to go see the surgeon. There's Alberta Health Services, they're launching this program. It's called Rapid Assessment Clinics. I applied, so hopefully we become one of them. But essentially the problem is that the wait time to see one of these surgeons is too long. Some people wait years, like 3 years. I've had people wait 3 years. And during that period of time, oftentimes people are doing nothing. They're just waiting. They say, there's nothing I can do. Their doctor says, there's nothing you can do. You have to see the surgeon. So then they're kind of in this limbo where they're waiting forever to see the surgeon and not doing anything in the meantime. And because of that, it can lead to all these problems that we talked about earlier. It can lead to, you're not using those muscles, so the muscles get weaker. You start loading some of the other joints in your knees, for example. So if your hip hurts, oftentimes you're going to be leaning over that hip more, puts more pressure on that knee as well. This is why it's very common for someone with a really arthritic hip or a lot of hip pain to also start getting pain elsewhere in their knees because they're just loading those joints more. Remember we talked about how arthritis, it's not a wear and tear, it's a wear and disrepair. So those extra stresses, your body can't keep up with repairing those tissues. So then arthritis starts developing more. So there's absolutely a lot of things that you can do to try to offset that. All the things that we talked about today, the stretches, the exercise, mobility, the weight loss, the conservative care. So trying to see one of those providers that I mentioned that are able to address all those different factors. Obviously myself, but some people find physio or acupuncture beneficial. If what we're doing is not helpful, then sometimes they'll do injections. What that does is helps reduce the pain. So for example, they'll shoot some cortisone or some hyaluronic acid in there to try to lubricate the joint, helps reduce the pain. So you're able to exercise, so you're able to do those things to help offset that. It's not going to stop the arthritis, but it can help a lot of the time, delaying the need for a replacement, or in some cases it stops the need for a replacement at all. So there's a lot of stuff you can do. So anyone that says there's nothing you can do for it, they're just either ignorant or just being a little careless with their words. That's my opinion anyways. Does that help?
Yep, for sure. Thank you.
Okay, yeah, for sure. A lot of times people will say there's nothing you can do. It's because you're old. And I'll tell them like, well, how old is your other hip? Because oftentimes the other hip is fine. So it's not really necessarily an age thing. It's what you're doing thing. Someone asks here, Evelyn, 58, don't have hip or knee joint problems. I want to avoid having hip problems as I age. Good for you, Evelyn, NYC. I think that's great. A lot of people are really taking a proactive approach to things, which I think is fantastic. So making sure that you're eating right, that you have a healthy body weight, that you're stretching, you're doing all those things that we really talked about, can really help a lot with either stopping the arthritic process from developing at all. And so you can live healthy and well and long into your 58, long into till you're 108. I've had several patients in their 80s and 90s with like, some have actually had no arthritis at all, and it's really tremendous. I've also had a lot of people with a lot of arthritis, but they actually have no pain at all, and they're actually able to live full and lives with and do everything that they want. So good for you for being here, and hopefully you found a lot of value out of coming today. Any other questions for me? Again, you can just type them in the chat there or unmute yourself.
Hi, Dr. Excuse me, Dr. Joe. I did put it in the chat. Anyway, it's Karen. I'm experiencing issues in my knees when I go to get up. Sometimes I really have to, remind myself, don't try to hurry because I have no strength. And it takes a couple of minutes for them to kind of loosen up and then I can go forward. But I think I'm pretty blessed so far not to have any issues with my hips. But clearly there's something in the works, so I'm here.
Okay, so same kind of principles apply to really any type of arthritis. This was more specific to the hip, so it gave some more specific direction there. But in terms of the knee, we have to ask a couple different things. One, we need to know, is it actually the arthritis that is causing the problem? A lot of times with knees, it's also a combination of possibly arthritis, or a tendon or muscle issue, or even a joint issue. So if for example, tendinopathies are extremely common, they affect all age groups. Basically, this is where you're climbing the stairs or getting out of the chair or going down the stairs, especially, is extremely painful in the front of the knee, sometimes in the back or the sides. A lot of times that can be a tendon problem. So we got to strengthen those muscles. We can do different types of therapies on them as well, to help try to improve how they feel and how they're functioning. A lot of the time, it's about trying to find the right stretches and right combination of exercises that you're able to do in a safe way and in a relatively pain-free way to still strengthen those muscles so you can get stronger while not aggravating the pain. Because, like, let's face it, a lot of times people, they try to exercise, but it's just too painful and they feel like they can't do much at all. And then that gets really discouraging, obviously, so you don't do it. And then when you don't do anything, you don't reach those guidelines of activity, things can really go downhill really fast. So you really need to try to keep up with those exercises, ones that are you're able to do. No pain, just a result of inactivity. Okay, stop being so inactive. A lot of times people get really stiff. So again, if you're not doing any stretches and you have really limited mobility in your legs, that can definitely cause some problems. So give that a try first before really doing anything. Some stretches, some exercises, and see if that's able to help you. Yes, we all know it's all about, we know a lot of things, but we just don't do them sometimes. And that's true for me as well. We all know we need to exercise, but sometimes it can be hard to do it. Just finding the time, or even myself, sometimes just being a little lazy. Anyone else have any questions? Yeah, and you can just type in the chat there or just unmute yourself.
Is the TENS machine good for knees or like sore legs in general? Or how can you, I've never heard of this. I think I've probably had it used in a physio.
Yeah, a lot of times physio places will use it. I'll use it sometimes. I don't use it all the time. The reason being is you can just get a machine yourself and you can use it wherever you are, whenever you want. They can range in price from I've seen them like 50 or 60 bucks, all the way up to, I've seen some for like $1,500. We sell one here. It has 8 leads on it. That's why I like this one. So you can use it in multiple areas or a wider area. And we sell that for about $200. All they do is they're trying to block the pain signals from the area that you put it on to reaching your brain. So if there's no nociceptive signaling reaching your brain, theoretically anyways, there's not going to be any pain. So this can be used for hip arthritis, can be used for knee pain, can be used for back pain, really any type of pain. There's obviously a couple contraindications for using it. If you have a pacemaker, it uses electricity, so you don't want to be doing that. If you're super pregnant, you don't want to be putting it on your belly because that can cause contractions and so forth. So there's a couple contraindications, but it's safe for most people. It's not addictive. It doesn't have all the side effects that the medications have. The only thing is you got to actually use it. A lot of times people get all these gadgets and they help, but then they stop using them because they end up in the closet. People get exercise equipment, all those different tools you see advertised online and so forth. I'm sure, have you heard of like Dr. Ho? That's kind of like the commonly known type of TENS machine. And he advertises it for a bunch of different pain problems. But essentially all it is it's zapping you using electricity to stimulate the area of pain. So those pain signals kind of get scrambled and don't reach your brain, so you don't feel the pain.
Okay.
Does that answer the question?
Does that kind of help for someone who's waiting for surgery then? Like something that lets...
Yeah, so that can be used for anyone. So if I'll usually suggest people get them, especially if they have persistent problems such as arthritic pain, because you can use it wherever you are. Like you just have to put the pads on. A lot of physio places will use it. They put like the TENS on your back or IFC on your back, and they put heat because it feels good, right? It doesn't solve the problem. It doesn't change all those functional changes. It doesn't stretch the hip. It doesn't hit on all those factors that I said you need to hit on to get lasting relief, to get lasting results, but it can help with the pain. And again, it's safe, it's conservative. It doesn't have the side effects of all those medications. Some people, if you're waiting for surgery or if you're not waiting for surgery, it can be really helpful in managing your pain. All it is a pain management tool, which can be very beneficial.
Okay, thank you.
Yeah, does that answer your question? So
Yeah,
the answer is yes, to be succinct. Awesome. Any other questions for me? We have 2 minutes. I can answer one more. Any takers? I have to go pick my son up for a dentist appointment, so I got to run. Yes, so Evelyn, I am planning on emailing the recordings. I hope this works. It's going to download on my computer. I'll probably send it out tomorrow or the next day to everyone who registered and who was here. Interesting, your email, it's not accepting autoresponder, so I had to personally send yours. So I will do that as well. Yes, so if you don't get it though, by the end of the week, like Friday or Saturday, if you don't get it by early next week, just email me and I will make sure that you get that if you don't get it for some reason, okay? But yes, I am sending it out. Any last questions? One more minute. Yes, my pleasure, Karen. Glad that you made it. Thank you, Terry. Yes, happy.
Thank you.
Yeah, I hope everyone got a lot out of this. If you have any questions, obviously, yes, he's actually does pretty good at the dentist. He's been a couple times, but I appreciate that, Evelyn. So yeah,
Thanks,
you.
Dr. Joe.
Yes, my pleasure, everyone. I will send this out probably tomorrow or Friday. If you don't get it by next week, please let me know, because hope you find, and there's a lot of resources in here that could be really helpful. Yes, well, Karen, when I do send that out, feel free to forward this information to anyone that you may find helpful. And again, if anyone wants this book, just let me know and I can mail you a copy. Assuming you're in Edmonton. I don't know, Evelyn, if you're in NYC, I'm probably not going to mail it to New York City, but you can get it off Amazon and $20. Or if you're local, you can get it. Or if you come by the office, we can give you a copy. Absolutely. Is there an ebook? No, it's just on Amazon. There's a Kindle though, and there's the hard copy. So I hope everyone found that helpful, and I guess we will see you soon. Have a great rest of your day.
Thanks, Dr. Joe.
Pleasure.